So, Dr. Jitesh,
Yes, yes,
we are live now.
yes. We can start, please. Thank you.
Okay, thank you. So, good afternoon, everyone. And yes, today we are celebrating Teachers' Day. So, first of all, pranam, thank you, each and every teacher of my life and everyone's life, I guess, because of them we are here. Whatever the position we are right now, it's all because of them. So thank you each and everyone who have been part of my life, and this is very important that we are having teacher in our life, because teacher is really greater than our mother and father, even other relatives also. So we really need teacher, because we really need guide when we have difficulties in our life. So we can ask them some difficulties. So it's not like that they will give you the solution, but they will give you the way. At least they will they will guide you, they will give you the right path, and that is very important. So every time if we go to our guru or teacher, uh, it's not like that he will give us the solution, but the right path is always important. So today, as we are celebrating the Teachers' Day, and it's been honor to everyone, and for me also, even to be the part of this session, and having such a guru in my life. He is my father, Dr. Amarsinha Nikam sir. So he will be with us in short time. So before that, I would like to present you some PPT. So I'll share the screen. So first of all, happy Teachers' Day to our God, our Guru, Dr. Jitesh. Is it visible?
Yes, all good, all good. Please continue.
Okay, fine. Thank you. So, first of all, happy Teachers' Day, and thank you to our Guru, our God, the noble researcher, Dr. Samuel Hahnemann. And because of him, we are here. Because of him, Dr. Nikam is here. And I'll say, like in COVID-19 also, many of the patients, many of the people got treated with homeopathy and they got the wonderful results. So that's why today we are having the topic of treating the COVID-19 patients with homeopathy. So I would like to share this screen with my father, Dr. Amarsinha Nikam sir.
Very good afternoon for everyone.
Good afternoon, sir. Happy Teachers' Day, sir.
Thank you. Same to you. Same to everyone. So today we are having a very great day. We are remembering our master, our guru, our teacher, our God, Dr. Samuel Hahnemann, who had discovered this wonderful science with extreme exciting results. With science which is having power that it can produce very fastest effect after giving the proper medication. We call, Dr. Heyman call it rapid, gentle and permanent restoration. How these things are happening in the patient. We read more time organ, but we are not following his instruction. We have to do research work along with this, our philosophical thought of our Guru. Every homeopath should try to match with the upcoming future difficulties. For example, COVID is one of the biggest point. Nobody had experience how to fight with the COVID. Nobody had imagined how to control the COVID. We are having great medicines to control not only COVID, in upcoming future more diseases. COVID is very new for us. That's why the entire world is fearful, anxious, and confused. All the physicians, allopathic physicians, Ayurvedic physicians, homeopath are trying their best, but still the mortality rate is very high. It is not like that the single medicine is going to work. For example, arsenic. No, never. Everybody had experience about the arsenic. Everybody had experience about the camphor. Everybody has experience about the sepia. So this is not so easy. This virus is a very intelligent virus. Its power is very tremendous. How he enters in the body, really, we cannot believe it. Virus is spreading house to house, home to home, and from bigger society, high grade peoples, medium grade people, and people who are living in the hut, Jhoppadapatti. All the grades of the society is suffering. The COVID never excuse whether the patient is prime minister or president or big politician, excellent actor, great actor. No, he never excuse anyone. He tries to do the attack on the human society very intelligently. How he is changing his character. We cannot catch a single character, pathological character. Every time the patients come with, sometimes with headache, sometimes with nausea, sometimes with vomiting, sometimes with chills, sometimes with a febrile condition, there is only loose motion, and so many things. So the changing of his nature is a really headache for everyone. That's why we are not going to get vaccine immediately because still it is long way to go. Still it is long way to go. Still there is hopes, but when the vaccine is going to administered on the society, it has to pass all the qualities. Anyway,
Many people
but
are wishing you happy Teachers Day.
wonderful thing is that we try to give preventive doses to our corona, to our society, to our people, and it works very nicely. It shows good immune response, and most of the patients are satisfied even mentally. So now the people are ready to fight with COVID. But the most dangerous attacking thing is that death. So we are observing our nearer people, our relatives are dying with COVID. And really, the entire medical field is become helpless, hopeless. But still we have to fight. Still we have to conquer over this COVID. And how to fight with the COVID is very interesting. Today I would like to show you some cases. In those cases, the presentation of symptoms is different and the remedies are also different. Even complaints are different. The patients are husband and wife suffering from COVID along with pneumonia. I wish before starting the case, doctors are wishing you before starting this seminar, I'd like to wish Happy Teacher Day to everyone. And I respect the great teachers of the world and even the small teachers of the world who are giving knowledge to our society and our people. So I am thankful with these old teachers, all teachers of all sorts of faculties. Thank you very much. Let us see this exciting case of COVID.
So thank you so much, sir. And yes, before we start the case, yes, we'll have some introduction about the COVID. We'll start with that. So, Corona and Homeopathy treating various COVID-19 cases on Dr. Amarsinha Nikam. As the pandemic of COVID-19 expanding globally, the media and internet is flooded with variety of opinion on cure and prophylaxis. In homeopathic community, also huge difference of opinions is also observed, and which has created much confusion. So before discussing Sir's approach on COVID-19, it's important to understand that dealing with epidemic is not at all new for Aditya Homeopathic Hospital. Yes, we had been treated so many patients of swine flu, even though still so many patients are coming to us of swine flu and COVID-19 and other pandemic also. Not only this, yesterday we had shown pneumonia case in our workshop batch. We had online sessions yesterday. Every Friday we have online sessions for the workshop students. So since last 25 years of Aditya Homeopathic Hospital, we routinely and successfully tackled many epidemics with same standardized approach. The approach is always same. Will not go into this. Everyone knows nowadays pathophysiology of COVID-19, how the virus enters in body and how it replicates, then how the RNAs are being separated, and there are multiple viruses as formed. Then there is response from our immune system, how the T lymphocytes work, how the cytokines releases and the inflammation happens. So everyone knows about the pathology, but here we are, the main part is our homeopathic practice. Yes, this is the last stage of COVID-19. This we can see the opacities in the X-rays or in HRCTs. The pulmonary edema will be there. So we'll go further. I'll not go in details into it. Yes, we know the symptoms also. There will be a dry cough, shortness of breath, fever, sore throat, headache, body ache, fatigue, diarrhea, runny or stuffy nose sometimes. And then there are investigations to be done. First is viral test. There is rapid antigen test. This will give the results within half an hour to 1 hour. Then RT-CPR is very important test. And then TrueNat test. The TrueNat test is not done usually. It is very rarely done. And then the antibodies test. Antibodies test we usually do after 7 days, after 1 week. This is not a proper test antibody. So these viral tests are important, first of all. And then in some cases, if we think the O2 saturation level is going down, then we can do the X-ray or HRCT also. Yes, later on there are in advanced form, like we can see the opacities. Then we have the advanced test also, that is the D-dimer, LDH, interleukin and serum ferritin. So what can be done through homeopathy? What we can do, how we can treat this COVID-19 through homeopathy? So basic thing is, in such viral epidemics, we had already seen that only few of the family members were affected and others were not, even when they were together. Also those who were affected, some of them recovered early and some could not. So this makes us understand that immunity plays very important role in such viral epidemics. So this is very basic. Then the principles of homeopathy works on maintaining the immunity of individual. That's why we had seen the immunity plays very, very, very important part in COVID-19 also. And the principles he is works on mainly on maintaining the immunity of that individual. So it doesn't treat the virus, but the person. The natural and gentle way of homeopathic healing helps the individual to recover his health without any side effects or harm. Now, we have seen many of the genus epidemicus. Many have termed many medicines as a genus epidemicus. So, what is the failure of this genus epidemicus? So, and why it is? As we see around, many homeopaths tried their best to find out the genus epidemicus, like arsenic, everyone knows, and camphora, bryonia, and others are. But they had given it as a prophylaxis and also as a treatment to the COVID-19 patients. So these medicines have been used tremendously, and not only as a prophylaxis, many of them had given as a treatment also. But they were insufficient in treating the cases. We know the results. The haphazard use of this specific remedies was seen everywhere, which was termed as a genus epidemicus. Even after this medication, number of patients tested COVID-19 positive. Yes, this was just a mess and complete failure due to the inappropriate use of homeopathic medicine without following the fundamental principles of homeopathy. Yes, in last prophylactic lecture, we had seen that to find out the genus epidemicus, we really consider a lot of patient, and then and then only like around 200, 300 patients if we had seen, and then only we can come to the conclusion that yes, this medicines works very efficiently in COVID-19. Still, there will be question to it is like really genus epidemicus, but what we are following, likewise, sir has told you that he has treated hundreds of patients through this homeopathy, and still we have not termed any medicine as a genus epidemicus medicine. So this is our prophylactic chart, and we had seen in the prophylactic lecture that how we differentiated this into thermal levels, into thirst and taste and sleep also. So I'll request sir to please explain about this chart.
This is a very easy chart to understand. We give importance to some essential points here. First thing is that we try to do the thermal differentiation, like that chili towards chili, hot towards hot, ambithermal. In the thirsty, there are two kinds of remedies, thirsty and thirstless. Aconite, antidote, arsenic, these are thirsty remedies. Thirstless remedies, antidote, acid falls, belladonna, Epasal, calibachrome, and so many others. In the hot chart, I can give importance to this thirsty and thirstless group. Towards hot and hot patient, aluminum cephal, antim crude, brine, coccus cacti, kali surf. These are hot remedies for the thirsty patient. And thirstless patient, Chelidonium, Drosera, Gelsemium, Mephitis, Pulse, and Spongia. In the ambithermal, they are sensitive to hot and cold. Again, we make two sections, thirsty and thirstless. For example, Mercor, Imai, Mercur drug, Moxol is a thirsty, and Lycopodium is a thirstless. We also give importance to the test. Basically, in COVID, more and more patients are having lack of test symptoms. Sometimes they feel more salty, bitter. Sometimes they feel tasteless. But while prescribing the acute remedy, we should give respect to the taste. So 4 types of taste are given, which are very gentle: sour, sweet, salty, and spicy. I cannot mention here bitter, pungent, and other tastes. These 4 tests are basic test which is required for the acute totality. Then again we turn towards the sleep. The sleep is also very important for the ill patient. There are variations of sleep, and we can reach to the exact remedy by exact simillimum. For example, comatose sleep. Fewer patients sleep like a deep sleep. It is extreme deep. Because of that, the sleep is having comatose sleep. Antimtar, belladonna, nux moscata, opium. Extreme sleep. There is a deep sleep in here. Antimtar, argentum nitricum, belladonna, carbovage, nux moscata, veratrum album, opium is there. Restlessness, arsenic, belladonna, carbovage, china, lyco, and Restox also. Restless sleep. And for sleeplessness, argentum nitricum, arsenic album, belladonna, hipasub, calica, nux vomica, opium, and Restox. This is a very wonderful thing. The opium is having comatose sleep also, deep sleep also, and sleeplessness also. Like nux moscata, it is more deep sleep is having. The sleep is so deep that patients are not able to awake quickly. We have to shake their body. In the opium, the same thing happens. Patients enjoy the sleep. They are having deep sleep, sometimes very comatose sleep. But what the sleep is indicating that this is the character. So you should go to look at the acute presentation of the case. In this thing, there is a restless sleep also, and sleeplessness also, with deep sleep and comatose. So it looks like strange, but it will give you definitely good results. So try to use these charts. And I'm experiencing a lot of remedies are also new remedies coming in this chart. For example, chamomilla is also coming in this chart. Calipachrome is also there. So just go through this chart and you will reach to the exact same area. So the first thing, thermal, second thirst, third sleep, and desire aversion. These are the physiological symptoms which are very essential to find out the correct remedy. Then, along with all these physiological symptoms, this is a very wonderful thing how homeopathy works. We give respect to the physiological symptoms, then only you will come to the correct remedy. So, along with physiology, you have to take the pathological symptoms like cough, expectoration, inflammation, like that. You have to add this in the pathological section. And then you have to observe the modalities, discharges. These are very important things. Discharges and modalities. And then if you are able to pursue the acute mental state with anxiety, anxious, fearful, confusion, panic patients, anticipation, that all the symptoms are required. But don't forget this physiological chart, which can lead you towards the correct remedy. So, first thing, this physiological chart. Second thing, pathological symptoms. Third thing, modalities, desire aversions. Fourth, characters, discharges characters. And fifth, mental. If you are going to collect all this data, you will really get happy. And if you are applying this method in the acute epidemic, pandemic situation, it gives very wonderful results. You cannot imagine. Again, I would like to show this chart once again. So this chart is really so accurate that it covers most of the severe pathology of COVID. So each and every drug is having a manifestation of COVID symptoms. This is the wonder of this chart. So don't forget this chart. And now I would like to present you how to tackle, how to face, how to give service to our patient and how to cure them. Just try to see these two cases.
Thank you so much, sir. And as sir has mentioned, yes, this is very useful chart. But this can be used in very if you have a short time and patient is like in hurried, and if you have very short time to take the case, then and then only you can use this chart. Or else if you have a good time to take proper case, then proper case will be preferable. Okay, and you can refer this chart, but it is not the ultimatum. So do consider this chart while treating the patient. And also sir has mentioned there are some few medicines also which can cover COVID-19 pathology.
For example,
And
pyrogen and jamovila.
yes, so and yes, before going to the case, points to be remember that there is no any shortcut to precise individualization in COVID-19 cases. Yes, even though sir had given you the chart, still there is this is not the shortcut way. Sir never follow the shortcuts. This is just for the reference. Then no single remedy can be curative to all. So as you had seen in the chart also, and if you had seen the cases of COVID-19, so sir had given multiple remedies. Means multiple means single remedy for individual patient, but there are total number of around 25 to 30 medicines are there which has been used for COVID-19. Also, in each of the COVID-19 infected cases, we have to consider the characteristics totality as we are doing in our routine cases. So, as we treat our cases, not about the COVID, but the other cases, as we are treating, same way we can treat the COVID-19 patients. Okay. Then particular attention should be given to peculiar symptoms while forming the totality. Yeah, this is very important. The particular attention should always be given to the peculiar symptoms when you are forming a totality. Okay, so these points to be remembered while treating a COVID-19 patient with homeopathic treatment. So we'll go towards the case. So as we told you, we'll show you some cases. So there are two cases right now, and we'll start with the first case. This is a COVID positive case. This is a case of an obese male, age 53 years, and he was diagnosed with hypertension since 10 years and had a history of bronchitis since 2 years. Presently, he came with the complaint of fever with the temperature of 102.7 degree Fahrenheit and cough. He was diagnosed COVID positive. So you can see there is comorbidity is present. Patient is already hypertense and having the history of bronchitis also. So this is the very critical case, and usually these kinds of patients get admitted and they start the other line of treatment. But here we had treated such kind of cases, and that's why we are showing this case to you. So the chief complaints are fever in the evening, temperature 102.7 Fahrenheit, fever with mild chills, heat more on throat region, sweating started after taking crocin, wanted to lie down, doesn't feel like to work, thirsty patient, and appetite is good. So these are the main complaints. And yes, we usually see these kinds of complaints in the patient. Fever with mild chills, heat more on throat region, sweating, wanted to lie down, thirsty, cough since 1.5 years on and off. Yes, as we had seen, he is already having history of bronchitis. So he is having cough since 1.5 years, and this has been increased recently. So as he's been affected with COVID-19, the cough has been increased. Cough with scanty whitish expectoration, obstructed cough, lying aggravation lying on back, aggravation at night, ambulation sitting erect. So physical generals. Physical generals, appetite normal, can tolerate hunger, desire sweet, milk products, oily food, aversion bitter milk, thirst, thirsty 4 to 5 liters per day, perspiration profuse on axilla and thighs, sour smell with mild yellowish stain, hot sweat, sweating over the part he lie down, sleep, sound refreshing sleep, prefer to lie more on right side, required covering. So we asked about his mind. In childhood, patient was living in joint family, and being the elder son, he was very much pampered. He was weak in studies and interested more in games. By nature, he was mild and always be in his own world. Since childhood, he was obese, so many times his friends used to bully him, but he never used to react. He was not very close to his father because of his strict and taunting nature, and also due to the business, he was unable to visit home often.
Sorry to disturb. The
Um,
voice got low. Earlier it was better.
yes, Dr. Jitesh.
Now the sound is better. The sound was less earlier.
Okay. Oh, sorry. Uh, yes, now we'll go forward as it's been clear and it's been shown to everyone, so they can read. Also in mind, the patient is having straightforward nature and having temper issues. He gets angry if things don't happen according to him. He is uh, he is very much work oriented and prefers all the work to be done perfectly. He is always strict and harsh towards his juniors. He is having stubborn personality, doesn't agree easily with others, but still is very sensitive and helpful towards people in need. He is a very caring person who cares a lot about his family. So this was his history, and we had seen the patient as having this complaints. You had seen all the case in detail. So this is what we do with every case. We have to consider all the parameters and follow the classical method, which is the right way to treat with homeopathy. So you have the case history with you as you had seen on your screen. Now we'll go towards the totality, but sir is expecting totality from all of you. So please write down the totality, and Dr. Jitesh and Dr. Jitesh and Dr. Rahul or someone will be there. If they are, then yes, share the
Yes, we will
totality,
check.
please.
We'll check. Yes, yes.
Okay.
Dr. Manish, what is the thermal? Hello.
Yes, Dr. Jitesh.
Yes, we have already got some totality.
Okay, fine, good.
Dr. Vishal, according to above performer, he considered hot patient. It was towards chilly, right? The thermal.
Yeah,
Okay, so he considered it wrong as a hot patient, but still he says thirsty, contradiction, intolerant of, fear of darkness, fever, aggravation in evening, desire sweets, cough, aggravation, lying down.
okay,
Dr. Aparna, totality, fever with chills, cough.
okay,
Dr. Urmila, cough with whitish expectoration, desire sweet, fear of dark, fever, aggravation, evening, cough, aggravation, lying down, and sitting erect, thirsty, thermally chilly, intolerance of contradiction, obstinate and careful.
okay,
Dr. Prasad, chilly, lying aggravation, back, night aggravation, fear of dark, sweets, desire, thirsty, fever in evening, perspiration, thighs, arsenic, naxomica, sepia.
okay,
That's it.
okay, fine. So, uh, yeah, okay. Anyone from YouTube?
Yes, one second, I'll just check. Okay, Dr. Aparna has given again the totality fever with chills, cough, aggravation, night, lying on back, desire, sweets, thirsty, perfectionist, family oriented, thermal towards chili, remedy, kali carb 30.
Okay, nice, nice.
Dr. Urmila is suggesting after her totality arsenic alp 30.
Huh.
Dr. Kazi has suggesting chilly, thirsty, sleeping on the right side, cough, scanty, whitish expectoration, obstructive.
Okay. Mm-hmm. Go ahead.
One second, I'm checking with the YouTube. Dr. Deepti is suggesting fever, evening, heat on throat, obstructed cough on lying on back, perspiration on lying down part, thirsty, desire sweet. Dr. Deepti is suggesting fever, evening, heat on throat, obstructed cough on lying on back, perspiration on lying down part, thirsty.
Dr. Jitesh, your speaker
Yes,
must
yes.
be.
Yes. It actually the YouTube got open. So perspiration or lie down, thirsty, desire, sweet, straightforward, nature, work oriented, family sensitive, helpful, stubborn, thermals towards chili, kali carb 30.
Go ahead, describe Kalika.
So, Dr. Hiten is suggesting remedy phosphorus. The Dr. Rajesh, patient thirsty, hot, fear of dark, temperature high, familial remedies, antim crude. DD is kali sulf.
And include is hot remedy.
Yes. Uh, Sir, there are a lot of suggestions in the YouTube as well.
You kindly
Yes, sir, I'm reading it. By Dr. Ranjit Pathak. Fever, evening aggravation, fever with chills, thirsty during fever, dull during fever, cough aggravation. Uh, at night, sitting erect amelioration, dominating, anger easily, workaholic, benevolence, thermal chili. Dr. Priya towards chili, cough aggravation, lying on back, cough sitting, erect ambulation, fever evening, perspiration profuse. Dr. Megha Patil, fever in evening, cough aggravation, lying, cough ambulation, sitting erect, sweet desire, obese, chilly, thirsty, family oriented, particular in work, angry, kali cup 30. Dr. Sarika, thirsty, hot, cough expectoration, white, perspiration, yellow staining, desire, sweet, mind, hard for inferior. Dr. Priya suggesting Antimtat 30, Dr. Nazma Kalika, Dr. Shiv Shankar Maurya, Asnik Alp, Dr. Jeevan Kalibai, Ayub Khan Kalikar 30, Deepa Bhalgat Asnik Album 30, Dr. Pallavi, uh, yes, Dr. Pallavi's Fever in Evening, Sweet Desire, Chili, Family Oriented, Perfectionist, Night Aggravation, Lying Aggravation, Kali Hours. Dr. Hetal Mehta, Lycopodium, Aniket Kulkarni, Phosphorus. Dr. Ashwani Patil, phosphorus 30, thirsty, chilly, white expectoration, evening fever, sleep position right side, perfectionist. Dr. Richa Raikar, cough ambulation, sitting erect, fever, evening aggravation, desire, sweet, intolerance, contradiction, family oriented, Kali Karp 30. Yes, sir.
very good. Everybody is doing very great efforts. It's completely shared. And they are trying their best. And it's a very interesting remedy. I think everybody tried to select good totality, and I congratulations to them. Some doctors are suggest remedy. Why they are so eager, I don't know. Still, you have to understand the case first, then you go through the remedy. But some excellent messages coming. Richa Raikar had taken. Yes, so many people are doing great efforts to select exact minimum. Just try to write down our totality. First thing, fever. Oh, write down the totality. Fever towards evening and night. Heat with chills. Profuse perspiration. Snoring. history of bronchitis, busy, discipline, family oriented, and towards chili. So, what is the remedy for this patient? I'm requesting to all doctors who are attending this webinar should give reply as quick as possible. I would like to show you the follow-up. Follow-up. So you are seeing the video. पुढचा आहे ना काय कट केलं? What is the remedy? Dr. Rajni Pachapuri, Kalikab, phosphorus, Kalikab, arsenic alba. Very nice. Ashwini Patil. Yes, try to suggest the remedy's name.
From YouTube also.
Sir, many people suggesting lycopodium as well.
Okay. Our students are taking great efforts. Yes. You see the yes. Try to select the proper remedy. Dr. Prasad, arsenic alba.
So we are getting Kali Ars, Entim Tart.
Most of the remedies are Kalias and Timtat. Somebody has suggested lycopodium.
Can we show these reports? Show reports.
Show them. अरे सिटीचा कुठे?
Just take the sun.
This is a chest X-ray of our patient. Now you can see there is no pneumonia marking is there. Chest X-ray is totally normal. अरे आधी HR सिटी दाखव.
So we're getting pulsatilla.
Okay. अरे HR सिटी दाखव ना. काय असं करतो वेड्यासारखं?
Suggestion. So there is a suggestion in Kali Karp as the person was not having a good relation with father.
Okay. Anyone who would like to? So now look at the remedy. Again, I would like to show you totality chart. Fever towards evening, night, heat with chills, profuse perspiration, snoring, bronchitis, history of bronchitis, busy, disciplined, family oriented, towards chilly. And the remedy's name is Kali Bichrome. Are you listening? Hello?
Yes, sir.
Anybody had given the answer of Kali Bichrome? Hello?
Yes, sir. Yes, sir. There is one doctor who has given the reply of Kali Bikram. That is Dr. Jeevan Pattare.
Yes, I must congratulate him. So, in homeopathy, there are different opinions and the people selecting their remedy as per their study practice, as per their experience, as per their own thoughts. That's why everybody's remedy is not matching with the proper totality. And the Kalika patients are very close, but he had a not good relation with father at childhood. The present state is taking care of father. So he is more family oriented, more disciplined, more caring person. And chills is more prominent. So there is heat which chills, profuse phosphoration, snoring, history of bronchitis, busy person, disciplined, family oriented, and towards chilly. So simply Kalibacrom is coming up. If you try to understand the case of the patient's cough, is very scanty whitish expectoration. The patient is having scanty and white expectoration.
So there is a doubt. Kali Beach is a thirstless remedy by Dr. Vijay, but the patient is thirsty.
Yeah, Kalibacrom is thirsty patient. If you are going to see the Kent repertory, you will get it. Kent repertory. Kent repertory. See the cough, scanty expectoration, obstructed cough, difficult cough. If you are going to open the chapter of stomach, thirst, in the thirsty remedies, Kalibacrom is given 2 marks. Scanty discharges is a character of Kalibacrom. With obstructed cough, dry cough. Okay, now we would like to go towards the second case.
So this is the second case, and this is his wife, that patient's wife, which I had seen in the first case. So both husband and wife got affected. So this is the case of female who is homeopathic doctor, and she is a wife of our corona patient who is diagnosed COVID positive with pneumonia, who is doing help and service to our corona patient. She was get affected with corona positive and pneumonia. She has diagnosed with fibroid uterus with left ovarian cyst. The chief complaints are cough with expectoration since 8 days, onset sudden, whitish, thick, scanty expectoration, sensation as if cough is obstructed in throat, dryness of mouth, dry cough, accumulation of tenacious mucus in throat. So I hope you're writing down the important points. I'll read it again. Cough with expectoration since 8 days. Onset sudden, whitish thick, scanty expectoration. Sensation as if cough is obstructed in throat. Dryness of mouth. Dry cough. Accumulation of tenacious mucus in throat. So these are the chief complaints. Then also burning, heat in the mouth, accompanied by fit of suffocation, respiration, short choking sensation, history of bronchitis. So also she is having burning, heat in mouth, accompanied by fit of suffocation, respiration, short choking sensation, and history of bronchitis. Then the loose motion since 8 days, watery stools with colicky pain, low grade fever with weakness and chills, started with chills covering desired, want to lie down during fever because of severe weakness. Okay, so is also having loose motion, then low grade fever is also there. Family history: mother cholecystectomy done, duodenal ulcer, prolapse of the uterus. Physical generals: appetite normal, cannot tolerate hunger, desired tomato, sour, and fruits, aversion to the sweet, milk, ghee, oily food, food aggravation, basin, and oily food. Head, headache, right sided, bursting, hammering pain, jerking, and pendulum like movement. In eyes, pulling sensation with bursting pain. Ears, bursting sensation of pressure from inside. Crackling sound during swallowing. Sensation as if everything will come out from ears. Mouth, halitosis since 3 to 4 months. Tongue white coated. Thirst half to 1, almost 1 per liter per day. Short quantity, long intervals. And thirstless. Teeth, history of toothache. Bowel, satisfactory. Bladder, scanty urination. Back, mild pain in cervical and lumbar region. Extremities, numbness of numbness mostly in fingers and toes. Perspiration scanty on neck and axilla. Hot sweat. Sleep disturbed since 1 year. Wakes up at 2:30 a.m. Lies mostly on back. Covering required up to chest. Habit of pillow between the legs. Dreams of dead people and black animals, especially cats, due to which startles during sleep and cannot speak. About his mind, her mind, sorry. Since childhood, patient was very studious and mild in nature. She is very emotional and sensitive person. She always prefers to be with people around her. She is having fear of animals and insects. She was having a shy personality due to which she doesn't mix easily. Patient was very close with her maternal aunt who died due to paralysis. Since then, patient developed fear of death. Now she is always having stress about her daughters and her studies, always worried about her husband's health. She feels that she always does good for other, but nobody thinks about her and cheat her. She never expresses out her anger, but feels sad. She is very irritable and doesn't believe easily, not even on doctor. She has fearful personality. Okay, so we have the physical generals and the mentals also. Thermally, she is ambithermal. So I hope you jot down all the important points, and we are waiting for the totality from your side so that we can proceed further. It's already 4:30 and we have 10-15 minutes more. So if you want to finish it fast, then yes, we require totality from your side. So Dr. Jitesh, please ask them the totality.
Yes, I would request everyone to please share the totality. Dr. Akshay Kate is asking Ignitia.
What?
Ignitia, the remedy.
We are asking about the totality, not the remedy right now.
Uh,
So guys, please make it faster. If you want to see it again, then yes, I'll show you again some of the important things. Okay.
so we have got the totality by Dr. Aparna. Cough, white, thick, burning heat in mouth, choking sensation, watery stool, heat with chills, weakness, desire, sour, thirstless, dreams of black cat, suppressed emotion, anxiety, timid, remedy, pulsatilla 30. By Dr. Vishal Borate, totality, frightened easily, dreams of dead bodies, suspicious, hunger, aggravation, mucus, tenacious, sticks to throat, bursting, pain in general, hot perspiration, mouth dryness with thick white coating. By
Okay.
Dr. by Dr. Subodh Jain suggesting pulsatilla. Dr. Vinayak covering desire for. Dr. Asutosh timid anxiety for anxiety of family member, fear of animal, suspicious, all discharge scanty, weakness, fever, hunger, intoleration, aversion to sweet, tongue white coated, thirstless. Dr. Sutosh has suggesting the remedy Kalikar. Then Dr. Saab bronchitis, aggravation 2 a.m., fear of animal, insect covering, desire, aversion, sweet, scanty. Dr. Sonali delusion of neglecting her duty, grief, losing the beloved ones. Dr. Preeti Rani Bovista, Dr. Pallavi scanty perspiration. Uh, she deleted the message. Okay. So till now the totalities which have been suggested. Dr. Deepthi, cough with white scanty, dryness of mouth, burning heat on mouth, bronchitis, suffocation, scanty, hot perspiration, thirstless, ambithermal, fearful, anxious, anger suppressed, irritable.
Very good. That is very good. Very nice response. Now try to find out the remedy. Try to go towards the chart of our totality.
So by Dr. Ranjit Patak, ambithermal, cough, expectoration, scanty, dryness, suffocated feeling, sleep disturbed, thirstless, desire, sour, right-sided headache, bursting pain, fearfully, grief, death of loved one. Dr. Aniket Kulkarni, cough with whitish expectoration, dryness, ambithermal, kali arse.
Very good.
Dr. Hiten, bad odor of mouth is very, very important. Dr. Sonali, scanty discharge, delusion, neglected her duty, grief of losing dear ones, anxiety about her relatives, pulsatilla natramure, rustox. Dr. Pallavi, scanty perspiration, obstructed feeling, anticipatory anxiety, burning heat in mouth, right-sided headache, sepia. Dr. Jeevan Padare, dry cough, tongue white-coated, antim tart. Dr. Sadhna, ambithermal, thirstless, fearful, dreams of dead, sudden onset of complaints, dry, scanty, thick, white expectoration, history, bronchitis, uterine fibroid. Hello?
Yeah,
Yes, sir. Dr. Manoranjan, suspicious doctor, tenacious, mucus, ignitia, and Hysomus.
very good.
Dr.
Everybody,
Neelam? Dr.
everybody,
Neelam? Yes,
yes,
sir.
everybody is trying to give an answer as per their knowledge. And everybody is taking more efforts. Very wonderful thing. Everybody had got the chart. Hello, Jitesh. Hello.
Yes, sir.
Everybody had got the chart of thermal
Uh, I hope everyone has it.
corona chart.
So I don't know how many people have it or have been saved the last webinar in which we shared the chart.
Decide
I request Dr. Manish to open up so that they can see it again.
let's try to see the chart once again. Corona chart. thermals.
So, Dr. Megha Patil, cough with scanty expectoration, tenacious mucus, dryness of mouth, watery stools, severe weakness, desire tomato, thirstless, fear of death, fearful personality, ambithermal, sudden onset, aconite.
So the chart is very important.
So, by Dr. Soni, cough sudden, scanty, thick, whitish discharge, suffocation, short, choking respiration, dryness of mouth, very timid, can't express anger, fearful, headache right sided, loose motion, watery, colic, suppressed emotion.
Very nice. I must appreciate their efforts. Yes, wonderful answers are there. Yes, Dr. Jitesh, anyone? Dr. Soni?
So, Dr. Dipraj Mullik has suggested spongia.
Oh, spongia is hot. Look at that.
By Dr. Sarika, cough scanty, tenacious, tongue white coated, dreams dead, cats, fearful, suppressed, anger, ambithermal, thirstless, fibroid, death, loved ones. So somebody is suggesting SP Mercor.
Yes, very nice.
Dr. Achana Sapte, Pulsatilla, Soni Shankar, Pulsatilla, Sadhna Bagul, ambithermal, thirstless. Chart has only lycopodium.
Very good. Fantastic.
That's it, sir.
Okay. It's very interesting remedy. Anybody would like to add in totality? Dr. Jitesh?
Sir, somebody suggesting Mercor and Pyrogenum due to bad odor. Dr. Monica Mundra suggesting Pulsatilla. Dr. Neelam, dry cough, tenacious, fever with chills, heat with perspiration, bursting, hammering headache, pulling sensation in eyes, desired tomato, mild, anxious, hypochondriacal by Dr. Neelam. Ranjit Patak suggesting Rustux 30.
Very nice.
By Dr. Meghna, dry cough, sudden onset, desired tomato, fearful, belladonna.
Very nice. Very interesting.
Dr. Kamlesh Econite, Dr. Anil Sipia. Dr. Riddhi Deshpande, Merck ad Ruber.
I would like to request them that don't go for particular food like tomato, like potato. Try to understand the taste which the patient requires. For example, for sweet, there are sweet. There are a lot of quality of sweet food is available. You have to select only the desires, not the multiple food. Just look at the chart now. This is a very simple chart. Totality. Try to write down the totality. First symptom, cough with whitish, thick, sticky expectoration. Sensation as if cough is obstructed in the throat. Burning heat in the mouth. This is a very exciting character of remedy. Accumulation of tenacious mucus in the throat as if accompanied by fit of suffocation. Respiration short. Choking sensation. Childish nature. Quarrelsome. Anger suppression. And the remedy. This is the totality. Try to guess the remedy. Dr. Jitesh? Hello.
Yes, sir.
Are you observing the totality?
Yes, sir. Yes, sir. Yes, sir.
And thermally?
Ambithermal.
Yeah. I had one book on the thermals, Water Medica, in which I had mentioned 300 homeopathic remedy,
Yes, sir.
which I analyze chili towards chili, hot towards hot, and ambithermal. This is also one more very interesting remedy which is going to add in the coronary disease, which works in this critical condition. I would like to show you the reports and the response. She had pneumonia. Now the test, normal test, absolutely fine. There is a report of the CT scan of chest. Are you observing? Dr. Jitesh,
Yes, sir.
there is a fibrosis also
Yes, sir.
in the lower lobe. Go ahead. Impression. Significant degradation. The multifocal area, peripheral, and sharp ground, grass opacity in the both upper, right, middle, and bilateral lower lobe with CT score. suggestive, clinical correlation. Hello. Jitesh
Yes, sir.
is a hemogram report. General condition of patient. Next.
Sir, I think it's time to reveal the remedy.
Very interesting remedy. Yes, anybody would like to suggest what a critical and a crucial condition of this? Now you just see the reports. Just COVID is negative. Everything is fine. Hello.
Yes, sir, but
Whatever.
Dr. Deepti suggesting chamomilla 30.
Yes, exactly. Remedy's name is chamomilla. Congratulations. Hello.
Yes, sir.
What exciting reports are there.
It's fantastic.
Everybody had seen the follow-up. So there is lung fibrosis with pneumonia. And within 2 doses is recovered. She's a homeopathic doctor and her husband is homeopathic pharmacist. So both are from the homeopathic family. Anybody has guessed chamomilla?
So as far as Dr. Deepti has only wrote chamomilla.
Who is this Dr. Dipsy? Surname?
Shinde.
She's my student.
Okay.
Okay, fine. Congratulations. She had got the National Award of Lippe just now, last month back.
Very nice.
Congratulations. And again today she had given excellent answer. Dr. Riddhi Deshpande, chamomilla. Dr. Riddhi Deshpande is also my student. She's from Nashik. Congratulations, Dr. Riddhi. Great. Thank you very much,
Thank you, sir.
and kindly request you to continue your study. Keep faith on homeopathy. Keep faith on your philosophy and medicine. The day will come, homeopathy will be number one in the world. Waiting for that day. Thank you. Bye bye.
So thank you so much, sir, for such a wonderful session. And yes, these two cases are very difficult, challenging cases for the homeopath, as they are having the already having the comorbidity of hypertension and bronchitis, which is already there. So this kind of patient we usually see, and there are almost 200 cases we have seen for COVID-19, and it's having excellent result in each and every cases, and that those cases are from ICU to from normal with asymptomatic patient from to ICU patients. So mild to moderate and severe, each and every cases had got tremendous results with the homeopathy. So try to follow this method, this classical way of treating COVID-19 patients with homeopathy. And yes, happy Teachers Day to everyone. And as we are having teacher like Dr. Amarsinha Nikam, it's we are feeling lucky and we are feeling honored to be with him always, and he is supporting us in each and every conditions, whether it will be COVID-19 or swine flu and other many diseases are there. So thank you so much for such wonderful session. Thank you so much, Dr. Jitesh,
Thank you.
for
Thank you.
being a good moderator as usual. And thank you so much, BJN team. Thank you so much, 360 degree homeopathy. And yes, thank you so much, audience, for being patient for more half an hour. So I'll see you all next time. See you soon. Thank you. Thank you, Dr.
Thank
Jitesh.
you. Thank you. Thank you.